you must be here for your cranial nerve exam. That's right. Perfect. I think I remember you from last week. Is that right? You were here for your eye exam? I see. How are you feeling after that? You doing alright? Okay, that's really good. That's really good. Well, you are in the right place. Please go ahead and take a seat. Get nice and comfortable. Oh, I'm so sorry. I forgot to reintroduce myself. My name is Dr. Louise. I will be taking care of you today for your cranial nerve exam. I just want to say before we begin that this is a very standard procedure. There is absolutely nothing to worry about. There is nothing to worry about. You should feel very comfortable and safe. I'll be taking the absolute best care of you that I can. Most of my clients find this procedure and this exam very comfortable and relaxing. I've had a couple of patients this week fall asleep during the exam, so you should definitely enjoy your time here, and I hope that you find it that relaxing that you also can fall asleep. You are very welcome to. Well, since this is your very first cranial nerve exam, I'm going to go nice and slow. Nice and slow for you today. I just need to ask you a couple of questions, if that's okay. Just like a few quick questions. I just need to jot it down in your chat. It's nothing scary or too personal, I promise. It's very standard. What is your first and last name? Lovely, that's such a lovely name. It's good to know that I have the right client here with me. That's spelled with an E, right? Okay. And what is your date of birth? Oh, your birthday is coming up soon. That's super exciting. Well, happy early birthday. Are there any allergies that I should know about? Any sensitivities? Anything like that? Okay. Cool. That is noted. Are you on any medications at the moment? Any within the last 6 months? Yeah? Okay. Have you had any headaches? Any dizziness? No fainting? Nothing like that? Changes in vision? And you can hear me alright? Hearing is all good? Okay, perfect. I assume so. Well, I just got your report in. Your file is looking very good. Yeah. That should all be good. Let me just finalize a couple more things. Let's check. Oh, I forgot to ask. Do you have any numbness or tingling anywhere? Okay, that's also really helpful. Really helpful to know. We can definitely look into that today and get to the bottom of it. Alright, just gonna close this and we can get started with your exam. I'm super excited to have you here. just take your time. Would you like a glass of water before we begin? Okay, perfect. Then I think we are all set. I'm gonna just put on a couple of gloves for our first part of our exam. Well, I'm just gonna walk you through everything as we go, nice and slowly. Just go one finger at a time. Alright, yeah. And let's begin with our visual tracking. You should find this very easy. I'm sure you have perfect vision already, but we have to just begin with this. So I'm just going to start here, put my fingers here, and I want you to watch these two fingers now. Okay. Very good. I'm going to go up. Keep watching as I go up and down. This one's very simple. Okay, I'm going to go backwards and forwards. Okay, just like that. Follow your finger with your eyes. Try not to move your head if you can, just your eyes. Very good. Okay, another side. Just follow these two fingers. Just your eyes, just your eyes. Okay, I'm gonna go side to side. Okay, very good. Keep following. Now I'm gonna do a circle, 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 and then the other way. Circle, 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 and then perfect. Then the diagonal. Okay, keep following, keep following. Very good. Other side. Diagonal. Keep following, keep following. Amazing. Really good. I think your visual tracking all looks exactly as it should. Very excellent. I'm just gonna take these gloves off. And let me just note that down in my book. Right, let's see. Visual tracking. And that was okay. Very good. Excellent. Nothing to worry about there. I want to move on to part 2 of the exam, which I'm just going to be using a little light. Nothing too bright, I promise. If it is too bright, just let me know. I'm going to give you a little example of how light it's going to be. Okay, just take a look. Is that okay? Okay. I told you it's not too bright. You can keep your eyes open for this part and just follow where the light leads them. Wherever the light goes, just follow, okay? You can do that for me. I'm just going to be checking your pupils, make sure that your response is all good. Okay. Just want to check your convergence as well today, so this is how. Okay, I'm going to turn the light on. Okay, here we go. Okay. And then I'm going to go up, and down. this side. A circle, and a circle, and a circle. Keep just following the light, Okay, I'm gonna just bring it closer into your nose. Just like that. To your nose. And then back. Can we bring it into your nose? To your nose. And then back again. Okay, looking very good. Your convergence is looking good. Check the other eye. Are you having any double vision? Everything looks normal? Okay, perfect. Okay, now I just want to turn the light on and off. Super simple. I'm gonna switch the light on like this, and then off like that. And I just want to check your pupils and see how they adjust to the light changing. And see your dilation. So, if you could just cover one eye for me and look at the light. Okay. Now the other side, the other eye, go to the eye, look at the light. Okay. Look at the light. Very good. Okay. Now I'm going to point the light in a direction. And I want you to tell me what direction the light was last pointing. Okay. What direction was the light last pointing? Blink if you need to. Take some time for your eyes to adjust. It's completely okay. That way. That. Okay. Excellent. Yes, that's right. Your pupil response is looking really, really good. Super healthy. No surprises there. You've never had any issues with your eyes, have you? Okay. Dilating normally. Okay, this is all a really great sign. Let's move on to part 3. This next part is just a little bit of fun. I want you to follow my fingers as they come into the screen, into your vision, and I want you to tell me when you see my fingers in your peripheral. Okay? Just start off by looking at my face. Don't look anywhere else, just my face. And I'm going to slowly move my hands into your vision, and I want you to let me know when you see them. Okay, let me know when. When you see them? Okay, good. When you see them? Okay, let me know when. Now you see them? Okay, very good. Now I'm gonna go this way. Cool. This way. Okay, very good. Yep. Okay, excellent. Keep looking at me. Just keep looking at me. And when I go this way, can you see them this way? Okay. Perfect. Well, I think your peripheral is looking nice and healthy. I will just jot that down in your notes. Peripheral vision. Okay, excellent. No need to work on that anymore. Let's put that there. And then just jotting down. You felt fine with that exam? Okay, I'll take a note of that. Very good. Let me know when you're ready to move on to the next part. Would you like a water? Do you need a rest? Okay, I told you this part was going to be relaxing, so I'm glad that you're happy to keep following along. I wanted to do a little bit of a touch test, if that makes sense. A touch test. Have you heard of it before? Okay. Well, it's basically where my hand, I'm just gonna trace gently along your face, just like this. And I want you to tell me what part of your face I am touching. So, whenever you're ready for that, let me know. Okay? And if I can just touch your face, just a little tap. I'm just gonna give you a little tap. Oh, also, make sure you close your eyes for this one. Okay. Okay, ready? What part of your face was I touching? The forehead. Very good. Okay, what about now? What part of your face? Your cheeks, yeah. Now, what about now? What was I touching? Okay, lovely. That was your nose. Okay, a couple more. Just gonna gently scrape along this side. Yeah. It's your eyelid. Okay, tell me now what this part is. Your right eyelid. Very good. That all felt good. Amazing. I'm very happy with that. And I'm just gonna jot that down. Touch test and face mapping is perfect. Okay, moving on now. I just want you to keep your eyes closed for me. You want to just close your eyelids just like that. I'm going to be using three different tools, and I just want to tell me what you think each one is. So close your eyes and no peeking. This is the first tool. Don't look. Okay. This is tool 1. What do you think this is? What does that feel like to you? A cotton pad? Exactly right. Good job. Keeping your eyes closed. Moving on to tool 2. Tool 2. I'm going to be touching the mic now. And what does this one feel like? What do you think this is? Makeup brush? Perfect, very good. It was a makeup brush. Tool number 3. Number 3. I'm not touching the mic for this one. I just want you to hear it. What do you think this one is? A hairbrush. Very good. Good job. Well, I think your texture identification is spot on, so I'm gonna write that down. Did such a good job with that one. Texture identification, spot on. Can you keep your eyes closed for me still? Now I'm going to be putting 2 different gloves on, and one is going to be smooth and one is going to be a little bit more rough. I would like you to tell me which one you think is which. If you can do that, let me know. This is just an extra add-on of our texture identification. Alright, are you ready? I'm going to be putting the first glove on. Close your eyes. Smooth or rough? Which one? Rough? Correct. And this one? Smooth? Okay, very good. This one? Rough. I'm going to be putting your forehead on your forehead. What was that? Smooth? Now I'm going to be going on your cheek, Rough, very good. Now along your nose, on your nose. Rough. Brilliant. Exactly right. Well done. I'm gonna write down your score. Let's just think a little. Okay, smooth and rough test. Looks good. That's 100% accurate and okay, let's move on to the next test. Keep your eyes still closed. This is my favorite test personally. I'm going to be using a couple of different scents on you, and I'm going to be putting them under your nose. Here is the scents that I have. For example, I want you to do a gentle little sniff in like this. Just one sniff, and I would like you to tell me what that scent was. What does it remind you of? There's no wrong answers, so whatever thought first comes to mind, just say it out loud and take your time with each one. Okay, we're going to begin with this one. No peeking, keep your eyes closed. I'm going to just be putting it under your nose. Okay. What does this one smell like to you? What does it smell like? Just gonna give you a little. What does it smell like? Okay, look a little more. A little sniff. It's orange. Very good. Now the next scent. Just a little sniff on this one. Okay, let me know. What does this one smell like? What do you think this one smells like? Yeah, that's raspberry. Very good. Now the last one. Last one. What do you think this one smells like? Let me know what this one smells like to you. Just a little sniff. Just a little. Pineapple. Beautiful. Good job. All of those responses were exactly as I would have expected. Completely normal. Very good. So, sniff test was accurate. All good. No issues. Slight delay, but no worries. Okay. Very good. You got 3 out of 3. Just wrote your score down. If you could keep your eyes closed for me, that would be amazing. If you want to take a little rest, you can. This part of the exam should go quite quickly from here on out, so we have done most of the more difficult portions. I'm gonna whisper a couple of words to you, and I would like you to let me know if you can hear me correctly, or just feel free to repeat the words back to me. There's no wrong answers again, but I'm just interested to hear or to know what your hearing is like. So I'm just going to say a couple words. I'm going to be going in your left ear to start with. Keep your eyes closed. Let me know when you're ready. Okay, very good. Pickle. 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 What word was that? Pickle? Okay, very good. Good. Good job. Now moving on to your right ear, to your right ear now. I'm going to be saying the next word, which is duct tape. Duct tape. Duct tape. Okay. What was that word? Duct tape. Very good. Very good. Now, to your left ear. One more time. Can we say the final word? Let me know when you're ready. Are you ready? Okay. Petal. Petal. Okay. What did you hear? Petal. Okay, excellent. Well, I think your auditory processing is perfect. All of your exam responses has been near perfect, so you should be extremely happy with that. There's a couple of more things I want to do with you, just like a little bonuses. I'm gonna make a couple of sounds around you, and I'd like you to let me know where you hear the sound coming from. Okay. Let me know where you hear the sound coming from. Yeah. Oh, I forgot to let you know my side. Okay. Right side. This is like a little tester. Now I'm going to make a couple of tapping sounds, and I want you to tell me how many taps you hear. Okay. You ready? 2. Next one. 1. There we go. And next one. 3. Last one. That was 5. Okay, exactly. Now close your eyes, and I want you to tell me what sound you think this is. Keep your eyes closed. Ready? What sound do you think that was? Spray bottle. Very good. Okay, let me know what sound do you think this one is? Lip gloss. Excellent. And the last sound. What sound is this? What sound is this one? Oh, go one more time for you. A glass? Perfect. Good job. It was a glass bottle. You did such a good job with that one. I'm going to put this down. Right down your skull. Thank you for being so patient with me today. Honestly, you're being one of my best clients that I've had all week. Most people start to lose patience by this time in the appointment, so I really appreciate you for that. Okay. Let me just write down your skull. Sensory. Hearing sounds good. Everything is good. Okay, that's all amazing. I just now want to test your sense of sound direction. So I'm going to put my gloves back on. For this one. Okay, good. I'm going to make some sounds, and I would like you to tell me what direction the sound is coming from. Okay, ready? Close your eyes. Good. 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 Very good. Now I would like you to tell me if the sound is near or far. Is it coming from near or far? Is it coming from near or far? Exactly. Good. Near or far? Okay. Last one. Near or far? Excellent. I'm gonna write down your score. Very good. Just one more thing that I would like to check after just hold still for me. Okay. Just gonna check on this here. Okay, any pain? No. Oh. Gonna just come around and check on this side. Just grab your ears like this. Okay. Any pain? No. All look really good. There is just a little bit of build-up, but that's completely normal to happen after you've just had your ear exam. So I think everything looks completely normal. Really, really healthy. I'm so happy with that. As long as you just keep coming back from regular checkups, you should be all good. And yeah, that's it. Exam done. You finished. I hope that you had a nice experience here with me today. You passed with flying colors, but I'm just going to take a little bit of time to formalize my notes, and I will email that off to you as soon as it's ready. That's everything, so you can open your eyes and just get ready. Everything might feel a little bit hazy, a little bit soft for the next couple of hours. I think you're gonna have a really excellent sleep tonight. It's completely normal to be a little bit dazed and out of it after your cranial exam, especially because this was your first exam. Yeah. No, that's all good. I am super pleased with that. You did such a good job. You did so well today. Get a good rest and take care of yourself. Everything responded perfectly normal. I have really no concerns. Yeah. No, you did so amazing. So thank you for spending the last half hour with me, and I hope to see you back in our clinic very soon. Okay. Take care. Bye-bye.